Hello, my name is Dr. Roland Owen. I'm a GP in Highfields near Toowoomba. Today I'm going to talk about weight loss in an elderly patient. This is quite a big subject and it can be quite daunting trying to work on a patient with this problem. I'm really approaching this with a pragmatic style, looking at what things you should and shouldn't do, rather than giving an exhaustive list of diagnoses and differential diagnoses. So from my point of view, the first most important thing is actually working out whether you're going to investigate and how far you're going to investigate the patient. And to do this and make this decision, you really need to involve the patient, if they're sort of competent and able to make this decision, and the family. If the patient's not able to take part in the decision-making process, the family on their own, but ideally both. This will actually save a lot of stress when you come up with diagnoses if they're not good. Using this as a starting point, it can be really effective use of your time, effective use of health resources. It saves you over-investigating people unnecessarily. And also from a medical legal point of view, it's a much better way of managing a patient and will reduce the risk of medical legal action from the patient or more likely their family if they're not happy with your care. So by involving everybody in the start, you'll actually have an open plan and you'll know what you're doing and where you're going. So when you're starting to investigate, do the usual basics, take a good history examination, review the medication, but also now look at the social side of things. Does the patient live at home? Have they got carers with them? Has there been any recent changes at home? Have they lost their spouse who used to be their carer and cook for them? Simple things like that, you can just overlook these and just get stuck into the medical diagnoses. So start off with the basics. Usually from there you'll get a good idea, is this a social problem? Is this a functional problem that the patient can't get the food, can't cook the food, etc. That's why they're losing weight and that's why they're not eating. Or if there's a more underlying, something more sinister, more medical going on. Also from their past medical history, you can usually get an idea of which way you're going first. Do they have chronic diseases? What chronic diseases do they have? Diabetes is always the big one. After that, you should hopefully have a rough idea which way you're going. But when you do start, the simplest thing is usually a basic blood workup and a urine test. So doing an FBC, ELFT, CRP, TSH, that's normally sort of a routine sort of starting point. And a urine culture, making sure they haven't got an occult UTI. That's generally a starting point most patients should have. So the next step from here is when you're getting into the more expensive and time-consuming investigations, radiology basically. And you've got to decide whether you're going to do this with a patient staying at home or whether they need admission to hospital to be thoroughly worked up. And it can be more time effective to do this, especially if you're more rural and you haven't got the resources nearby and need to be sent to the nearby town, or not so nearby town, then you have to make this call. And again, this is where it's really good to involve the family, because they might be happy to say, look, we don't really care. It's more important about quality of life and quantity of life for our relative, and might decide it's better just to leave things be. So this is when you're starting to get into the differential diagnosis lists, which can be quite large, and you've got to use your own clinical nous here to decide what you're going to go for. Obviously, cancer from head to foot is a differential diagnosis. Infections, occult infections. Obviously, the blood test will give you a slight marker if you've got raised inflammatory markers, etc. But this is where really you need to use your own sort of initiative and decide where you're going to go next. And you can just look up lists of differential diagnoses if you're not sure where to go. But hopefully, this has given you a good starting point, a good thought process to get you going. Thank you.